good morning, everyone. Warm welcome from Zurich to this IUSSP online workshop about new ways of transcribing, visualizing, publishing, and providing access to data on epidemics and contagious diseases. So just very briefly, a little bit about the background. So this workshop is part of the IUSSP panel, Epidemics and Contagious Diseases, the Legacy of the Past, which is about improving and enhancing the understanding of these past epidemics and contagious diseases. So COVID-19 really highlighted that the epidemics remain a persistent global threat. So the pandemics exposed also deep-rooted structural inequalities in health, and they remain actually poorly understood. And also uncertainty exists about how societal changes have shaped the impact of the diseases over time. And this is also, one of the issues is also that the key drivers of differences in health and mortality as well are not well defined. So this is really the scope of this panel, which is led by Tim Riswick. It is also in the room here in Zurich. And this panel is, or was, and still is organizing workshops which focus on specific historical diseases such as tuberculosis, influenza, smallpox, plague, malaria, but they're also focusing on methodological challenges. And this is exactly what we are doing today here. In this workshop, we focus on the methodological challenges. And this is really also about, the panel itself is about an interdisciplinary approach. So it's about inviting scholars from that really diverse fields to overcome fragmented research traditions. So the aims of this specific online workshop we are now realizing today is, again, to bring experts from various disciplines together and to focus on methodological questions. This is about transcribing, visualizing, and publishing data. It's also about working with handwritten or printed historical sources. It's about handling structured and unstructured data. And it's also about an emphasis on innovative and modern methods. And you will see it in a minute. All the talks, they somehow focus on specific time points across the entire research pipeline, from transcribing data until visualizing and analyzing it as well. So it's about, today is really about sharing insights and best practices, and to also maybe foster new collaborations, and maybe, you know, beyond the meeting, then also build a sustainable, regularly meeting community. So we had actually over 100 registered participants. So we will see how many we have actually then really present in the meeting. But really, it was really an international audience signing up for the meeting. So it's a really almost or above 30 countries we are from. And I think it would be even a broader landscape if we would look at disciplines, the different disciplines being present in the meeting. Huh? So this is the program. You saw it already. We have 3 sessions with 10 presentations. We are now in the first session already. We really have a broad mix of topics and also regions focused on, and also time periods. So each of the contributions is scheduled to last 15 minutes. So we would have the speakers are informed to speak for about 12 to 13 minutes, so that we have short time left, 2 minutes roughly, for Q&A questions. They can be asked after the presentation by just raising your hand, the digital hand. So we go then in order of the raised hands, or they can also be posted in the chat. And at the end of the meeting, we will forward all the questions and comments you might have in the chat to the speakers afterwards. I will also, at the beginning of each talk, I will post a link to a speaker's personal websites in the chat, so that you could also, you know, trace back the people and know who they are. And I'm so sorry if I should, dear speakers, if I should mispronounce names or places when shortly announcing you. You also see that one talk has been cancelled, very short notice this morning in session 2. So in session 2, we have now 3 instead of 4 talks. We just have a little bit more time there for questions and answers. Huh? So this is the outline of the day, and we would dive now into session one. And I would unshare my screen and ask Vijay Kumar from the Institute of Management in Ahmedabad to share his screen and then to give the first presentation.
Sure. So thank you so much for giving me this opportunity. So thank you so much for giving me this opportunity to presenting at the international platform. So basically, in that I will present that how the geospatial technology or the digital innovations are contributing in that the new data, a new era of the data and the epidemic of the data, and how we can enhancing the transcriptions and the visualization, and how we can use in public health for the better access or universal health access. So basically in that the how they have to epidemic or the landscape of the landscape of epidemic responses, how they can epidemic data collection that have the manual, slow and fragmented process, leading to the significant delay in the public healthcare access and the responses. Basically, just we can see through that right now the example is the COVID pandemic is the starkly highlighted these the critical gaps in the data worldwide faces by us, and the emphasizing the urgent need to the rapid and precise and how we can actionable information get from the data, and how we can take action as soon as possible. Another like we globally outbreak in the increasing the threshold since in 1980s, the imperative of the innovative data solution will have never been greater, pushing the boundaries of the traditional and the public health approaches, and they can how we can actionable intelligence we can use using the technology or the geospatial technology or the digital innovations. So in that the how the geospatial technology or is innovative, at that how we that can particularly targeted to particular point of what we have to need to solution given there. So on the basis of that the geospatial innovations and the transforming how we are can precisely transfer pandemic, and that the GPS or the GIS data enabled mobile data capturing, we can capture the easily through the mobile app or any instruments, and particularly go on the pinpointing individual cases with remarkable accuracy. And well the satellite, we can also see that the NASA and the from the India IIRS, so they can capture the images through the satellite and provide the crucial insight into the environment risk factors, and that some such as the temperature or the water pollution and the air pollution. So basically, on the basis of these data or the satellite data, we can go for further that the spatial analysis tools connect cases the specific location and sources, which location is more affected than policymakers can target specifically that location, and after then they can give the solution on that basis. The deeper understanding of disease, specifically in the when we will talk about the health context, so the policymakers can target the specific area on the basis of where the disease is spread, and the primary example of that the effective mapping of the cholera clusters and campaign on the basis of the water points, and which facilitate target interventions. So, digital innovation or accelerating data transcriptions are significantly in the process of the data transfer in epidemic response. In the current AI era, they can rapidly capture the digital contents and mountain of the paper reports, converting them into the enabled data. And then natural language processing extract the critical insights from the unstructured text, while speech to the text tool streamline field data entry, and the reducing manual transcription error by up to the 7%. And we can also see through the social media analysis, capture the data from the social media also, through the metadata through that X and the Instagram, they capture the data, and we can solve the using the natural language processing or geospatial techniques. These advancements ensuring that the public health officials receive timely and accurate information crucial for the effective decision making. They can solve as soon as possible on the basis of the current data. So how they can show the advanced visualization through the heat map, through that cold map, or the network analysis, a lot of the through the interactive dashboard, GIS dashboard. So so compiling. So advanced visualization are essential for the essential techniques for the identifying the spatial pattern of the epidemic data, or that any disease. So interactive the GIS dashboard provide the real time display to the database spread, how they can in real time spreading the disease, and allowing the public health officials or the policymakers to monitoring outbreak as they unfolded. And the heat map instantly identify the high incidence clusters, and highlighting area required immediate attention. By the overlapping of the infrastructure and the demographic data, these visualization tell us about that the context about that the disease or the epidemic, and facilitating target intervention and optimizing resources deployment to the most affected communities. Which communities is more affected, so directly public health officials can target that. So, on the basis of the dashboard of GIS dashboard, how they can dynamic and the predictive modeling we can use the dynamic modeling or the predictive modeling. They can use the real time data aggregation, the AI driven forecastings, and the intervention simulations. So, on the in the that's powered by the real time aggregation by cold platform, cloud platform offer, and the unprivileged view of pandemic solutions, such as the AI driven model are now capable to the forecasting outreach and trajectories, providing early warning and enabling protective measures. Through the simulations tools evaluating the effective of the various interventions, helping the decision makers and they can choose the optimal strategies. We can also see the example from the John Hopkins. They develop a dashboard for the showing the global impact and the utility, such as the powerful visualization and predictive tools managing the healthcare crisis. And another is the cases with the Mulaf at all in 2016. They have to do case study on the malaria surveillance in the Kenya, particularly in the rural area. How they can do that before the malaria intervention, after that the malaria, and what are the outcomes of that case study. So, on the basis of this case study, highlight the transformative impact of these innovations and malaria surveillance before and after, how they can do that manual survey, leading the 4 week reporting and leg survival handling and the timely interventions. And by the implementing the smartphone data and the tools, using the data collection, and after then they map the GIS mapping, and this leg was dramatically cut to just 3 days. And these practices real time mapping allowed to target incidents sharply based on the accurate geographical data, and resulting is remarkable that the 35% of the malaria cases intervention zone is reduced. And the domestic is the triangular benefit of the integrated digital and geospatial tool in the public health programs, after they can find in papers. So another case study I have done with my co-supervisor, co-author is Professor Tulika Tripathi. That paper is published in EPW. In that we have to done the how the tribal areas are unable to access the healthcare facility on the timely, because health is the need to the access on the time. So we draw a draw a map, and after then we try to find out how their households are unable to find how they are not able to access on the time. And there is the distribution showing the distribution of healthcare facilities, and how they have to not connect to the road networks, and they are not able to access it within time period. So that paper is also considered by the government of India in the Niti Aayog for the policy document plan. So they are working on that, how they can using the geospatial technique or the digital data, and they can allocate the new healthcare facility on the basis of a geographical distance and all these things norms. After then this study we go, another do the paper, that is the case study of the particular district, that is also a tribal area, how they have to connect it to the road, and these black dots are showing the household locations, and the red dots are showing the here the existing healthcare facility. On the basis of these analysis, we another give the solution to the government using the two-step floating catchment area. The green dots, if they given the health facility to the green dots location, then these area is able to access the healthcare facility within the time specific or the 10-kilometer access. So after then the road enhancing and how they can ahead the integrating the emerging technology using the blockchains, and for the securing data is the computing the analysis and the AR of the information. So the future perspective of the epidemic data lies in the integrating an era of emerging technology. So there is the offer secure the immutable data sharing, enhancing trust and the interoperability across different health systems. And the computing enable real-time analysis directly in the field of reducing the latency and the improving immediate decision makings. And the virtual reality or the augmented reality present existing probability of the immersed epidemic data explorations, allowing the health professional to visualize the complex information into the 2D or the 3D in the geographical locations. And in also we can also advance this the carefully considering of the ethical implications, the particularly data privacy, algorithm basis mitigations remains. These types of the we can also ensure equitable and the responsible deployments. So also we will also face the challenges in this traditional epidemic data. So how they can to solve the data entry and the data inconsistency, sold information, and limited spatial insights. So in that the manual transcripts can delay the crucial reporting to the, by the 5 to 7 days or then more than that, embedding the rapid response effort when every hour can count using we can when will we use that technology. And that data inconsistency when we will do the manually, that human errors will be showing that our data. So the in through the technology or the AI or the geospatial things, we can reduce the manual error, and the significant data quality issues will and is increased, and we can offer the 10 to 15% of the records leading the flow analysis and decision making can solve. So soil information also is that the disparate and linking system prevents comprehensive. For example, we have to working on the any type of the research, so we need to link between the environment data and the health data or another type of the sectors we need to call like interlink but in the technology we have to directly go through that using the dashboard or any other AI systems or the digital era. So in that the limited spatial insights are right now available in the worldwide. So without the precise location data, we have to like such of the boundary data. For example, we have the India data, but we don't have the exact location which person is facing the problem. So when we will enhance that geospatial technology in that, so we can find out the which where is the exact problem. Then we can solve the policymakers will solve easily in that context. So geospatial revolutions mapping of the outbreak. So how they can geospatial information is the real-time hotspot identification, the pinpoint disease clusters, and with the precisions and allowing the public health official to optimize intervention is directly where is the where is the problem in exact location, and we can also reduce the cost benefit analysis also. Another one is the resource allocations. The resource allocations is also automatically need to reduce, enable to 30% of the more efficient deployments and medical teams vaccines essentially supplies ensuring critical resources reach vulnerable population directly. They no need to go to the whole population. They can go where is the problem, they can go and treat according to them. So mobility training is also easily advanced. Geospatial technology is also analyze the population movement pattern and providing critical insight into the how they can disease spread can information and containment the strategy make the strategy according to that. So another same example I have also given the before in previous slides. John Hopkins is developing a COVID dashboard, and that dashboard is showing the power of the GIS and leveraging the GIS of the visual global pandemic in the real time, how they can face the worldwide, and specifically in the particular point of a time and which location. So in that, the enhancing the visual and from the data to insight, how they can enhancing and how they can visualize using the geospatial technology or the digital era. They provide the real time data, and the epidemiological trend will draw capabilities, allowing users to explore data at various level of granularity and identify emerging patterns. So in that, the second is the spatio-temporal. That means the geographically with the time, how they can facing the problems. We can see through the animations. So through the visualization, disease preventions over the time, specifically offering the dynamic insights into the outbreak, evaluation, the spread, crucial for understanding the transmission of the dynamic. Another one is that the user friendly infographics. So we know that the cartography of the how human eyes are attractive according to the colors, we can produce the no in the current scenario, humans are not ready to easily read the paper, so they can see the visualization of the different colors, and they try to analyze according to that. So on the basis of the user friendly infograph, translate complex epidemiology data into accessible and easy to understand visualize to the public for fostering better understanding and complies with the health guidelines. And after then, the all these things impact on the policy, how the policy will enhancing on the basis of these. And we have to also see in the papers, approximately the 40% of the enhancement using the geospatial technology, they have going increase the in the health area, and as well as the another area, those who are using the digital era or using the geospatial techniques, they can enhance or impact the policies more as than others. So another is the empowering the public health access and the engagements, how they can engage to the publics, and how they can contribute in that. So public facing portals are, we can also easily, they can easily see through the diagrams or the figures and understand what is going in our area, particularly in that. These accessible patterns of citizens and actively reduce the man information by the estimated around 20 to 25%, and building trust and the empowering communities to be to accurate data. And we can using the digital era, we on the basis of the prediction early warning systems also we can incorporate in the using the digital era. So leveraging the predict analysis and how they can system enable to proactive intervention by identifying the potential outbreak before they accelerate and saving lives and resources. Interoperability and the standards also we can incorporate, and the facilities can and then secure seamless and secure the data sharing between the various health agencies, and breaking they can solve the problems as soon as possible. Increase the trust, enhance the transparency and the accessibility of the healthcare data, boost the public health as well as the private healthcare systems on compiling the vital health advisories, and using the vaccine campaignings, and the, like using the some NGOs the platform and crucial collective can take actions. So how the future AI, predictive analytics, and the global networks, they can use the geospatial techniques, and how they can intervene, and how they can mix up the digital twin, predictive modeling, and the global data sharings. So in the predictive modeling, they will forecast the trajectory with the using the accurate data. They can take the accuracy in the predictive modeling more than the 90%, and enabling the proactive public health intervention before the epidemic accelerates. And the digital twins in the vital reflecting the environment will allow all the sophisticated outbreaks, simulations, testing, intervention strategies without the real world risk. So another one, that is the global data sharing, how they can share to the another they can help in that perspectives. So real time collaborative network will facilitate seamless international data exchange, ensuring and find global responses to health crisis. So on these, the innovation the promises a more prepared world, critical challenges they can face easily, and ensuring the robust data privacy, deploying AI ethics, and the guarantee equitable access to these technology, as well as the facilities they are available in the public domain, and inclusive and reliability resilient global health futures. So on the basis of the all these things, we will also go in that
Just to
direction.
quickly interrupt
Yeah,
you, sorry. You have 1 minute left to come to an end. Is that okay? I'm
sure, sure,
sorry for
sure.
that.
Yeah. Definitely, I will in.
Thanks so
And
much.
so, yeah, thank you. So in that the all the perspective we can, when we will see in that the how the digital perspectives are contributing in the human life, how we are going in the new era of the epidemic, and then how we will face the difficulties using the geo spatial technology, as well as the digital twin and all these things. So in that the geospatial and the digital tools are fundamentally transforming the public health and having a new era of epidemic preparedness, and they enable to faster, more precise and the data driven responsible outbreak. And we can also sustain using the investment of these technology and crucial ensuring the global resilience and against the future health threats. Ultimately, the collaborations, innovation across the government, organization, and communities will be the key achieving in the listing of the impactful challenges and how they can manage responses to the epidemic worldwide. So, thank you so much.
Thank you so much, Vijay. That was a very nice overview. For the sake of time, and because there is no question in the chat, we would directly move to the next speaker, and we go from modern day India to 19th century New Zealand. So, Moana, could you try to share your screen and unmute yourself? So next speaker is Moana Rarere from the University of Waikato in New Zealand. I hope that was not too wrong.
No, you did well. Thank you so much, Kaspar. Greetings from Aotearoa, New Zealand, at the bottom of the Pacific. So my name's Moana Rarere, and I will be presenting our research entitled here. Just put simply, it's a new paradigm of 19th century Māori demography, and I've listed our research team here. So I'm going to, basically the outline of our research is just to provide some, first I'm going to provide some context, hopefully in 1 minute, a condensed version of our history, and then I'm just going to touch a little bit on Māori demography, and of course that will help provide some context and positioning of our research, and then I'm going to quickly cover what our research project's about, the aims, our objectives, the methods and examples of some of the data that we've collected today. So just to note here that we are in the very early stages of our research. We started roughly formally 6 weeks ago, but this builds on earlier research that some of our team members did with a Māori community that focused on population reconstitution using parish records, genealogy from local knowledges. So really I'm just sharing what our research is about, what we're trying to do, and what some of the challenges that we'll face, and hopefully with some guidance or some wisdom here in this forum. For example, maybe you could share with us some of the technologies. We've heard from the previous speaker, some of the AI technologies, for example, that would help us decode or code, transcribe some of the material that we're dealing with. So here's our very short, condensed version of Aotearoa history. We are focusing on the late 19th century, so between 1840s to 1901 in particular. And this was a time of rapid Māori depopulation. And so Aotearoa, New Zealand, it is a settler colonial state. British settlement, colonisation formally began in the mid-19th century. Aotearoa is the homelands of the Indigenous peoples, known collectively as Māori, who arrived decades earlier, even before it was discovered. So pre-colonial society was organised around kinship groups, hapu, which is a smaller kinship groups, and iwi, another tribal or larger kinship groups, each with their own territories, customs and governance systems. We also acknowledge that there were early contact between Māori and European or non-Māori that started in the 18th century. So there were some friendly relations there. But in 1840, that was quite a key turning point in our history. The Te Tiriti or Waitangi, or the Treaty of Waitangi, was signed. And what the treaty meant was, well, what it was designed at the time to protect Māori rights, especially sovereignty, but was somewhat interpreted very differently by the British Crown representatives. For example, the Māori version of the treaty emphasised governance and partnership, but the English translated version emphasised full sovereignty for the Crown, while the British while the British immigration increased rapidly after 1840, it significantly transformed the demographic and political landscape of Aotearoa. And it's had very profound and lasting impacts on the Indigenous peoples. And just to name a few things, land loss, dispossession, cultural suppression, for example, the loss of language, political marginalisation, but I just want to focus on the impact that it's had on Māori population in particular, and just to give you a scale of sort of the massive change that happened population-wise. And if we take, for example, pre-contact period, Māori population was estimated, and it's very rough estimation, it was estimated around to 100 to 150,000. And that was in the late 18th century. By the late 19th century, that dropped to around 40,000. And so it's here at this point of time where we position our research in this latter part of the 19th century. And it's quite a critical time period in Māori demographic history. So I just want to pivot to this Māori demography. And so the need for population data about Indigenous peoples has always been integral to the state's political agenda of colonisation and nation building. And that legacy still continues today. Demographic changes, for example, declines in total population, shifts in the relative size of hapu and iwi, rises and falls in death rates and birth rates were central to the process of colonisation. Here in Aotearoa, there's been vigorous debates which have had on the debates about the extent and causes of post-contact Indigenous depopulation. So the fatal impact of European contact and conquest and how those past events continue to shape the present. However, we do question some of those reports, observations, the data, let alone the legacy of census taking. The prevailing account is that the Māori population declined rapidly after the signing of the treaty, due to largely due to disease-induced mortality. But much of the scholarship leans on the work of demographer, the late Ian Poole, who used government censuses, documentary evidence to quantify a 19th century Māori population change. And so demographic analysis requires data on the size and age structure of a population at a given time, changes arising from births, deaths and migration, but only some of this data exists for 19th century Māori, and the quality is quite patchy. So Ian Poole used various approaches to try adjust for errors in his sources and to derive the best guesstimates. Critics have questioned the methods used to produce these estimates, but have not as yet offered any credible alternative. So our project, the high-level aim of our project is to try and build a new paradigm or new model of 19th century Māori demography. Our approach upends the dominant focus on national level data and dynamics by developing a more localized approach that values Māori knowledge systems and Māori sources. So our research combines novel statistical methods, critical analysis of original census records, and insights from Māori sources to provide a more complete account of 19th century Māori demography. It does build on major advances in demographic and statistical methodology that have occurred since Ian Poole did his original analyses. I can hear some background noise, sorry. Okay, so we actually face some challenges. We are working with quite fragmentary data sources to draw inferences about past populations, and we also acknowledge the lack of quality and reliable census data. Of course, scholars primarily relied on vitals data, births, deaths, genealogies to reconstruct aggregate level trends in population size. And so this is some of the challenges that we have. Although Aotearoa's later contact meant we have more extensive range of statistical record sources, but it does come with its own peculiar errors and biases, and estimates are subject to a high degree of uncertainty. So these are three of our key objectives. It sort of forms the structure of our research, but I'm just going to focus on, really focus the remaining of this presentation on objective number 1, which is theorising how Māori population was constituted through colonial census taking. And so in 1840, the Māori population did not exist. It had to be constructed. And so we want to understand the processes by which this construction occurred. So the first, I guess, stage of our research is really sort of grappling with the historical analyses. So we do want to sort of undertake a critical analysis of Māori census documentation from 1874 to 1901. So that's when the first Māori census was collected in 1874. It's a period of peak decades of colonisation, depopulation, and colonial census data that's readily available. And so our analysis is guided by this question here. What can colonial censuses tell us about past Māori populations? And one way we approach this is by understanding the process by which the census and those involved and it constructed the Māori population through discourse. So that's written descriptions in informal and official contexts. Categories such as tribes, iwi hapu, natives, and practices. So that's aggregating local counts, for example, into larger categories or spatial units. And so we intend to interrogate some of the information that we've some of the original census correspondence, reports held in our National Archives in our capital city, Wellington, along with published reports and other colonial records. And we also note some of the key agents of interest, including local Māori, the police, resident magistrates, overseeing large and often quite fractious districts or areas. Also key politicians at the time who were seeking information to advance their own agendas, for example. And so through this analysis, we want to build a picture of how the Māori population came about, how it was encoded as a category that could readily be observed, quantified, and managed. So I'm just going to show you a few examples of the data that we've collected so far. So obviously a big part of it is collecting the actual data. We're very lucky. Our statistical office, our National Statistical Office, has actually digitized a lot of this data. But some of the things that we have to really grapple with is trying to understand how some of these categories have been defined. So for example, and I hope you can see this, but You know, so here they've collected data about numbers of Māori by certain counties or areas across Aotearoa, but they also collected data about half-castes living as members of Māori tribes, whatever that means. So that's some of the things that we have to sort of deal with. So we want, and part of that too is understanding, well, where's the other people who didn't live, or I guess half-castes who didn't live as members of Māori tribes. And this is some of the, I guess, the challenges that we're facing with this type of data. Here's another example. Here, this is quite clearly a report. Screenshot one of the reports from the enumerators sending their report to a government official. And I just want to highlight here, again, some of the difficulties that enumerators had in terms of getting data from, I guess, the natives. And here, the Māori king at the time was King Tawhiao. And so there was obviously some challenges around, well, I guess some resistance around giving information to enumerators. And also just also want to show another example, the data that we're dealing with, some cursive handwriting. I chose this example because it was easy to read, but most of the documents, they're very, very hard to read. And so it's going to be a very painstaking process. But it also shows here an example of how some of the challenges that the enumerators had. So this note here, it actually says, well, post returned Saturday, had trouble getting names, absolutely refused. Some settlements, others had to visit twice. So obviously some enumerators had to go back, try their best to engage with the natives. But this is just one example of a correspondence between enumerators within one file. There's actually quite a lot of it. And so the challenge for us is trying to piece together, like a jigsaw, I guess, to get an understanding of the broader narrative that's going on at this time. Our next step, really, we've still got more material to collect. We've already sort of got a lot of folders and files there already. We still need to just, I guess the biggest task will be trying to decipher the scanned images. And like I said, some of it's really hard, very difficult to read. Also, our database at the moment, we're using an Excel spreadsheet. And so so in that document, we're just creating, I guess, an index of the files, a summary of the info, descriptions, the years covered, and noting any key observations within the information that's been collected. We also need to compile the census data set. So there's about 7 censuses that occurred within that period. Luckily, we do have some of that already digitized, and also developing a template of definitions and frameworks. So that's it's developing, I guess, a template of observations that tell us something about the quality of the census information in order to determine the nature of the problem and error disturbances. So I'm actually going to finish there.
Thank you so much, Mona. There's one question in the chat. What are the methodologies you are using to decipher scanned images? Because images with handwritten textual information is hard to recognize most of the times.
Well, that's why I'm actually here in this workshop. Hopefully there's someone who can actually, I mean, the thought is probably, hopefully there's some sort of AI technology that could read. We're actually unsure. I mean, other than actually doing it manually. Yeah, I don't really have an answer.
How many, what is the sample size actually? So what are we talking about? The number of images you would have to?
Oh, we're looking at, oh gosh, hundreds.
Hundreds. Okay.
Yeah, quite a lot. Some of that we'll probably have to go through and sort of do, yeah, some sorting, some organizing. I mean, we're still, like I said, very early stages. So, yeah, maybe 500.
Okay.
Because we've scanned just about everything,
Yeah.
little memos, not just reports, yeah, all sorts, everything that's in a file, and some of the files are quite big.
Yeah.
And that's over, yeah, that's quite a lengthy period as well.
Thank you. So if people in the meeting who saw they're already incoming now, that in the chat you see, I will forward it to you. Huh? So people in the meeting might have ideas how you could do that. Huh?
Great, thank you.
Okay, thanks so much. That was a fascinating insight in a very important project. And now we would move back to India and a more technical talk, I assume, from the title. And we go to Gaurav. Gaurav, could you share your screen and unmute yourself?
Yeah.
So our next speaker is Gaurav Raj from the Population Council in India. Go ahead, Gaurav.
Yeah. Thank you, Dr. Kaspar, for giving me this opportunity to showcase my work, whatever I have done with the data. And so I was actually working on a similar type of problem at Population Council. So we have a product here that is called MPOD, and it is basically a data quality, data collection, data management tool, which people people which who use this tool, they basically uh, collect data from their mobile devices or their tabs. Data goes to the server, and then after these steps, I got the data. So data can be in the any format. Sometimes it is audio, sometimes it is images, sometimes video. But I am not discussing about the videos here. I am specifically discussing about the images, the textual data, the audio data. So let's move forward. I was actually working on a data set where I have to extract handwritten Hindi textual data uh, from you can say uh, that is a confidential data actually, because there is a lot of personal information of specific people from states of India. So so I have taken a small sample size where their data previously must remains intact. So uh, so I just want to introduce. So uh, so whatever people showed before me, like the data was really handwritten. It was messy. Sometimes it was printed data. So I have actually worked on these type of messy data. So that's why I already asked that how are you uh, deciphering the textual information, because I usually work on this type of textual data where I have to extract information from images. So uh, with so my goal is to develop an end-to-end system that can extract information from images as well as audio uh, to proper transcribe textual data, and then that can be further analyzed easily, because everything gets into text and in specific English language. So that's what the problem I was already working on, and when I got this opportunity, I just applied for it. So let's move forward. So you already saw that the people have previously showed that sometimes the data which we get uh, 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 any AI system, if we develop, needs proper, you can say, proper annotation of that particular data, so that we can train our system, whatever we use with any language it is possible actually. But I am specifically working on Python, so I will try to explain it via Python. So uh, and so the challenges here are like, the data is really unstructured. It is very difficult for us to understand what is even written in that particular image. So and it is also a difficulty for the AI system, whatever we are going to develop. So the problem is for both, but with few measures which can overcome this difficulty, and I will discuss it about later. So uh, the data is also restricted sometimes. In my case, data is also restricted. I have taken a very small sample size from 10 to 12,000 images. I have taken only 100 images for this test case. Apart from that, data is also very poor in quality. The images are blurry sometimes. The angles from which the images are captured is very bad. You can't read exactly that, okay, this is 4 or this is 9. Sometimes that happens. So I was just trying to apply large language models and AI to transform the workflows where I can get insights faster from the data, and it can help us to analyze it further with, because everything goes to the text, and the texts are easier to analyze now with the help of LLMs, other NLP techniques. So this is the reason there is a need for innovation. Let's move forward. So I wanted to show some data that how uh, what data set I have taken. This is a pretty recent data set that is from that is MCP card. Uh, that is its abbreviation is mother child protection card, where lots of information is collected from patients during their pregnancy period, and everything is written here. Sometimes it is in English, sometimes some numerical values are present, sometimes some Hindi textual information, either printed as well as handwritten, both are present. So I was trying to train an LLM, and I started with Llama first, because Llama was launched at that time a few months back, and then for the and I have also chosen a specific model that is multi-model. It understands vision as well as textual information, and I have already mentioned that I have used Llama 3.2, Gamma 3, and latest one, that is Pixel, launched very recently, last week I am guessing. So these are the models which are performing better. So I am taking these models to train on this data, and how I am training, I will discuss it in my next slide. So uh, and apart from that, I want to discuss about one more thing. I also get data in the form of audio files, and audio files are of multiple languages of India, or it is possible. I have not tested it, but I think German, French, other languages are also possible to transcribe with the help of this Whisper OpenAI's open source model, which is speech to text model, and it is pretty fast. It is actually I have written a pipeline where I just I just get the data from the servers. I just run the model, leave it for the night. Next day I come, just send the people that okay, your files are transcribed. Pre- uh, Previously, it was very difficult to transcribe specific audio files because you have to search for the people for that specific language. They will charge you a lot. But this has I was and I was working on this problem for a long time, and after getting this, uh, I wrote the pipeline. It is working very good, and I am in future we will be thinking that okay, can we integrate this with our product, that is MPod, and that can be very helpful because data goes to the server. Then if someone wants to transcribe it, it will happen automatically. Uh, there will be no support required from some person manually in any manner. Yeah, so let's move to the next slide. So I've taken a visualization example. How do we getting the data uh, and understanding the textual information, extracting the data from. So for visualization purposes, I have used a lots of things. Uh, Apart from Python, I have used JavaScript and its libraries to visualize my data. And this is also a live dashboard which I have developed for Ministry of Health here, and it is running with their health management information system. And similar can be achieved with the help of Python libraries like Streamlit, Dash, Radio, Power BI, and also GIS mapping. I guess someone was also talking about this, that okay, how can uh, uh, data can be mapped, and so all these things are possible with Python only. If we want to build an end-to-end system from front to back, applying AI, applying GIS, applying anything, so Python has that capability. And also, if we will feed, because it can be built as an end-to-end system, real-time tracking of disease spread is also possible, because all the information is already stored in the vector database, our LLM. So every time new data comes in, we can try to match that. Okay, is it matching with the current data or not? So is this an outlier? So there can be something happening in that particular part of the world. These type of visualizations and alerts can be built with the Python with the help of LLMs. Yeah. So let's move to the next slide. Yeah, so I have shared you an example that how I am preparing my data for the image extraction. So I just have to prepare uh, I just used some annotator, image annotator. There are many open source annotators. One of them is label image, and another one is BGG image annotator. So with the help of this, I just try to label my image. If I go to the suppose because I have taken this one. So if I am trying to annotate this particular uh, image, then what I will do, okay, uh, this particular Hindi text means date, and if I am marking it as it's and if I am marking it, then there are coordinates of this image. This image has some uh, x x1 cross x2 length and breadth, and if I am annotating it from here to here, then there is an x1, there is an x2, there is an y1, there is a y2. So like this, I am annotating that okay, this is date, and and So it is a category. So then, so now, where is the exact date? So I will mark this x1, x2, y1, y2, this area as a uh, as a coordinate, and I will give it to the LLM basically. And this data, after this data processing, this data with image and its labels with the coordinates, and what is written there, either in Hindi, it can be numerical like this, so anything can be possible, and it goes to the LLM, and then an LLM is uh, trained basically to understand this information. That okay, first it will try to understand that, okay, what is the particular data present, like if I am talking about date, so it will understand that okay, in particular Hindi, we write date as like this, and if I am talking about some numbers, so it will understand that okay, when there is some 152 centimeter height of some person, so date, the image will be related to data, that there will be a mapping like this, and after that we will try to, after training, we will try to just evaluate that okay, whatever data we are getting from on fresh data sets, what is the accuracy, our uh, predicted versus our uh, actual values are matching, how much similarity is there, what is the fluctuation in that evaluation, and there are various evaluation methods for images. So like we can, there are parameters which if you have used gamma on AI Google Studio, you have seen that there is a parameter temperature, so we can adjust that temperature automatically. We can also fine tune it so that we get the best results. And I am actually working on this problem right now, so it needs to be solved yet. I am working on it, but I am getting better results day by day, because I need to have annotate the data first, and the data must be good, otherwise it will be very difficult to gain the accuracy. Yeah, and I would also like to talk about the impact of LLM approach. So with the LLMs, you all have used ChatGPT, Grok, and other AI models, and you have seen that uh, we get the data in fraction of seconds. If we are taking a huge image, we try to generate something from the. It takes some time, but it is still very efficient. So, with the help of LLMs, our process of transcribing the data can be, uh, we can basically increase the speed of that. Because previously, if some person is doing that, it will take 1 month, but an LLM can do that in maybe some hours. We keep it running for some hours, and it is also scalable, and we can do the same for multiple languages. We can extend it for solving different types of problems, like in with medical images. Suppose we are trying to detect cancer in medical images, so this can be extended towards that also. So uh, and uh, it can be integrated with any sort of visualization, and uh, visualization with any kind of dashboards with multiple languages. Either we can use JavaScript, we can use only Python, uh, any language. So uh, it is integrable with other systems also, and
Uh,
maybe all around. Okay, so I am guessing there was some noise. But also developing this type of system has some challenges. I am also facing similar types of challenges, and one of them is noisy images. I get very blurry images. I can't annotate these type of images, so I just have to drop these images or contact that particular person who has supplied the images to me. Apart from that, the picture quality of images is low. It can be in black and white, or something is written, but maybe it will be very difficult for the AI, for the if we take that picture for the training purposes, maybe the AI will get confused. Our algorithm will basically not work properly. So I just drop those images. And apart from that, there is a limited availability of uh, properly annotated training data. So when I was trying to search for some training data, it was very difficult for me to get some Hindi textual annotated data. So I just had to annotate it myself to train the model. And also the data preparation part, where I have to annotate all the data. It is a manual process, but I am also working on one innovative way where I can train the LLM, uh, basically a bigger one, like Llama with 405 billion parameters, and train it on that. Okay, how to annotate a particular image. So these type of things I am experimenting with. These are still going on, so I am not sure it will work or not, but I am trying to solve these problems in this manner. And but with these challenges, uh, there are some solutions, like generating some synthetic data with again with the help of LLMs, or with Python. There are some libraries which can generate synthetic data. So with these, and we can control that synthetic data to a larger extent. So that can be helpful while developing such systems. And also the data needs some advanced processing. Sometimes the data can be of any size, any length and breadth, but we have to keep it in a specific uh, matrix format, like 3x3, 4x4, so that AI gets the standardized data. And apart from that, also converting all the data to you can say black and white sort of, so that uh, our AI system can easily understand the. It does not have to spend time on uh, converting it. So we just try to convert it into uh, the chloral. Let's be black and white. That really helps when working with the images. So and I guess so. These are the things I tried to explain, which I have worked on, and with the help of LLMs, we can we can we can enable we can get good accuracy with the data, whether it will be images, whether it will be text, whether audio. So uh, and also for there is a future aspect also. This can be used as a real-time analytics system, where we provide the fresh data to the LLM, and it will analyze it. Okay, and try to understand the data well, that if is the new data coming in is aligning with the training data on which model has trained or not. If not, then it can raise some alerts that, okay, there might be some epidemic happening on this part of the world or like that. So yeah, that's what I just want to conclude. I am open to questions.
Okay. Thank you so much, Gaurav, for this fascinating insight in your methods. There is one question in the chat, but maybe you could take the time to answer it there in the chat because we have to move into the break. And
Okay.
we are back at 11. Thanks so much to all the speakers so far, and see you in a minute. Huh? Okay, I think we start session 2 on time with Swiss, almost on time with Swiss precision. Our first speaker in session 2 is Gabi Wittrich from the University of Zurich, who will speak to us about tricky tables. So go ahead, Gabi.
Thank you very much, Kaspar, for having me here to actually present my absolutely failed project that has been haunting me since 2022. When I tried to test the text encoding initiative or TEI guidelines to fairly upcycle digitized historical statistics. So let me first give you a short overview. I'm just giving you an overview of the project background and its inspiration. Then basically the main part is presenting TI to you with regard to tables. And then I'm showing you what actually made the project fail regarding the table structure. And hopefully we can come over the challenges in this workshop together. So actually my project was based on a digitization project of my former colleague, Joël Flores, who did the Willy Brecci Fellowship at our partner institution, the Central Library in Zurich, where he tried to quantify and contextualize the Spanish flu in Zurich according or with the help of Zurich's monthly statistics on, well, epidemics, death rates, and stuff like that, that have been published on the Zurich's open library or open platform, ZOP. Along with Joël's project, I actually did an advanced study and did a pilot project paper titled From Book to Machine, XML as Platform Independent Machine Readable Format as a part of this kind of library education. And basically Joël and my idea as economic historians were to make historical tables analyzable with statistics software directly when they have been digitized. However, as I said, basically it stayed a pilot, but I'm really becoming more hopeful that it's going to work out in the end. I was actually inspired by a really early digital edition about using the annual fiscal accounts of the city of Basel that were upcycled as an HTML format as well as a facsimile and a table view format online. Basically, these texts are based on XML processing, in both in accordance with this TEI framework and the RDF framework, which are usual frameworks used in digital editions. And as I said, it's kind of a really early example from 2015 of a fair data edition that is findable, accessible, interoperable, and reusable. So what about what is the TI? It's actually really kind of a standing organization or consortium that has been developing and maintaining standards for the digital representation of text since 1994. That is basically since the beginning of digitization per se. At the moment, we're standing or using guidelines 4.90 that were published in January this year. They basically keep on updating the guidelines on a half yearly basis. It's a really large description with 24 chapters that explain TI and define the respective XML-based text elements, including a really short part on tables in chapter 15. TI is actually structured with having a TI root, a header, and a text body. So that's the core elements. And it's definitely having advantages with regard that it focuses on the meaning of words and text and not on the layout. It is software independent, so it's really open. And it's supported by a large open scientific community that you can join. However, with regard to tables, as I said, there's just a really small part of them, because probably layout and presentations are definitely much more important in tables than in continuous text, of course. And table of processing is usually done in other XML notations than TI. So let's look at the table Shirley and I actually wanted to have, well, digitized in a way that we can actually also analyze it quickly. It's death statistics according to death causes and age, where we have the month of appearance. On top, we have the page number, we have the title of the table number. Then we also have some text and numeric column headers. And we also, which makes it even more complicated and complex, sums in both columns and rows. And we have another row where we compare numbers or the sums of the same month of the previous year. So, and of course, that was also, we have 0 values with a long dash. So there's quite a complexity in this table that actually then looks like that in TI or in the XML version using TI elements. Here you actually see the TI header elements, basically with the title of this XML version. Then we have an edition statement and a publication statement that basically describe what we're doing here, as well as bibliographic information on the original source, that is on the printed sources and where they are located and stuff like that. So, and you can extend that massively, but these 4 elements are basically the mandatory ones that you need in the TI header elements all the time. In addition, then when we look at basically the table version in the TI format, we again have the title, we can include the notes for the table number, we have a date for the table. Then we have a header row or head row for the label of the cell. And then, of course, the table is actually organized row by row and then cell or cell by cell. So the first bit actually of these, what you see here is actually just the header row of the original table. So it's really quite a lot of code to basically put in not so much information. Incorrectly, I actually ignored the lines and long dashes just for reasons of visibility at the moment, which would be needed or would be mandatory in original TI. And of course, I mean, there's many empty cells, as we have seen regarding or leaving out the long dashes. So kind of it's really getting complex, but it's still human readable. But of course, basically putting that in by hand is really error prone. And why did I have to put it in the by hand? That is due to the really lousy original or OCR input that came out of the digitization of our colleagues, and we actually talked with each other. The contractor uses Tesseract, but definitely does not adjust the table format. So they just run OCR over all the table, and that's basically what we see here. The output is really kind of a joke. My favorite part is the Krankheit of the Bier. So the illness of the beer down here, that is of course not really what it meant. So I basically had to transcribe the table by hand in 2022. However, and I've been basically fighting with all the challenges ever since. And until recently, actually, LLMs gave really incomplete and or false results when they had to extract information from tables. However, in May, I actually found, well, two versions, or a colleague of mine actually also gave me a hint that Google Gemini is actually really good with these text extractions, where I only had to give a short prompt, and the output was relatively accurate, but still had mistakes regarding numbers. But of course, to use these LLMs as a to output or to extract the information in tables, image quality has to be good enough, which we have already seen before in the presentations before. Up to May 2025, I actually used OpenAI to kind of check, and the reasoning model did also relatively well, but the prompts had to be more tailored. So all in all, at the moment, the LLMs are still well, need some human check and correction, which I hope should be soon be able to be done via prompting or, of course, coding. So there's still challenges left, even 3 years after my failed attempt of this digitization project. So we still need either OCR recognition in digital copies that are adjusted for tables, or we probably rather need image quality that is sufficient. And here, of course, we as libraries are in charge to provide these. Another thing that's probably the main challenge is that both OCR and TI are flow text oriented, and of course tables aren't. Which means that we still have to do the manual transfer sometimes, or manual check of the table content, and then still get this manual XML version or table version into TI structured text. So basically, table recognition and XML coding are correspondingly still deficient for structured text like we have in tables. So we basically have a chicken and egg problem. So we probably need more XML-based tables to train the models better on table recognition regarding text recognition, or with regard to text recognition. However, as I said, I'm kind of hopeful that basically actually upcycling these historical tables according to TI is generally possible. Of course, these comprehensive TIX elements require a lot of training for practical implementation in XML. However, as we have seen that TI actually offers tools that can be used to capture complex structures of historical tables. And also, if you use serial data, you can track changes with TI in these table structures. And it gives out platform and software independent version of table data, but so do, of course, CSV and TXT versions or formats. So TI in general is suitable for structuring continuous text and less suitable for text where structure determines meaning, like in tables. But I really hope, and I'm looking forward to more presentations on that the workflow becomes easier with improving AI tools and LLMs. So thanks a lot. And I'm looking forward for questions.
Thank you so much, Gavi, for this insight and into struggles which basically many of us in the audience, might know from their own experience over the last years with those tricky tables. Is there a question for Gabi? We have time for one question or two. I have one, Gabi, if I may quickly. So was it the original idea that as at the university library, because the original source is open access published, right?
Exactly.
Was it the original idea? Didn't you also publish the data set alongside with the source?
Yes, yeah, that was the, I mean, it was really an experiment. Joel and I just, I mean, it was actually a project work for this library course or further higher education course. So yes, actually, Joel, my dream was to basically put out the source or the copy, the digitized version of the source along with the data in the source. But seeing as it didn't work out, we basically, just left it at that. And well, I mean, really just failed basically, or my project actually just failed in that sense. Joel's, I mean, the data or the tables are actually online, so they are available, and people can basically experiment with the content now. But of course, I mean, these are monthly statistics, so there's a lot of data in there. All of them have about 30 pages of tables, and our original idea was basically really to capture the content of these 30 tables altogether, but as I said, I managed one single table to basically upcycle one single table of, well, several thousand, I guess. So, but of course, I mean, once you have the training material or some basic material, I'm pretty confident that it might work out. So I'm looking forward to having all the training data.
Yes, I agree. Okay, thanks so much. So we would move, when there is no other question, I don't see any, then we move to the next speaker. Thanks, Gabi.
Thank you too.
So, Kaushik, are you there?
Hi, Kaspar.
Very good to see you. Could you share your presentation? Thank you. Okay, so our next speaker is Kaushik Sarkar from Forecasting Healthy Futures in the USA. I hope that was correct.
Yeah.
Go ahead, Kaushik.
So, thank you, Kaspar, again for the invite. And ladies and gentlemen, good morning, good afternoon. My name is Kaushik Sarkar. I'm a medical doctor, an epidemiologist, and an engineer. I lead the Institute for Health Modeling and Climate Solutions, a center of excellence that was formed by Forecasting Healthy Futures. And this presentation was supposed to be done by my colleague Grace Keem, but she's at the SRI Congress, so I'll be presenting on her behalf. So before we start, this workshop focuses on new ways of transcribing, visualizing, and providing access to data on epidemics and contagious diseases. But today I want to challenge how we define that data, because the reality is epidemic data is no longer just case counts, diagnostics, or lab reports. In 2025 and beyond, epidemic intelligence must be multidimensional and also multisectoral. As Kaspar, I think, mentioned up front, it needs to merge health data with climate signals, system disruptions, and real-time environmental risks. So it's not just about what's happening in hospitals or health clinics, but what's unfolding in the atmosphere on satellite maps, in rainfall patterns, and on the ground in communities days before the first patient walks in. So that's the frontier we have built at IMAX, and it's what I want to walk you through today. So at IMAX, we believe that data is the new vaccine. And in the face of escalating climate-sensitive diseases, we are building the operating system for public health resilience. So we launched IMAX in 2022, hosted within Malaria No More under the Forecasting Healthy Futures initiative, with one mission: to equip the world's most climate vulnerable countries with the tools, intelligence, and systems to see what's coming and help it stop before it spreads. Now, today, as I mentioned, I'll talk about climate and health data together. Now, as you all know, climate is no longer a background variable. It's a primary driver of health outcomes. Storms disrupt supply chains, heatwave change disease maps, floods knock out health facilities. Outbreaks today are bigger, faster, and hitting harder. You see the dengue situation in Asia Pacific, one of the classic examples. And this is not just where we expect things to happen. The diseases are shifting in time, geography, intensity, and that's why the old ways of surveillance and response are no longer enough. So to survive and thrive, health systems need to move from reactive firefighting to proactive forecasting. That means new policies, dynamic programs, and operations that are fast, flexible, and forward-looking. And exactly this is where climate data comes in. That's not as an academic layer, but as a kind of lifeline. It tells us where to act, when to act, and how to act smarter. It's a bridge between uncertainty and readiness. But let's be honest, on one point, climate data is hard to use. It comes in grids and layers, as you see here and also here, in formats most public health teams weren't trained to read. It's misaligned in time and space, and there is no one-size-fits-all strategy for how to merge it with health systems. Different diseases, different geographies, different platforms all require tailored approaches. In some systems, as you can see, climate variables become continuous predictors. In others, they are kind of triggers that flag anomalies. That's why the solution isn't just integration, it's kind of intelligent disease-specific adaptation. And technology has finally caught up to the problem. Big data, artificial intelligence, and cloud are giving us the superpowers, letting us harmonize complex inputs, transform high-dimensional data into usable formats, and surface patterns that no human analyst could detect alone. So the intelligence that we see below, that's not about replacing human intelligence, it's about kind of supercharging it. Now, talking about intelligence, it is quintessential at every level, but the focuses differ. At the community level, it's about empowering health workers with tools that guide real-time action. At the public health program level, it's about targeting resources, optimizing interventions, and tracking what works. And finally, at the policy level, it's about shaping budgets, strategies, and national priorities. And as you see here, these aren't separate layers. They are kind of connected gears. And when they move together, systems get stronger. Now, let me bring this to life with our work in India. In India, we deployed digital systems that gave frontline teams predictive insights on fever and malaria trends, localized stock planning, workforce deployment, and even chat-based support live in the field. We integrated weather alerts, diagnostics, treatment guidance, everything a community health worker needs to go from data to action in real time. So it's real, it's working, and it's changing how public health is delivered on the ground. I'll pause for a bit for you to watch the illustration here that's going on the screen. So as you can see, the dashboard, and then there was a mobile application to support the work of the frontline health workers, as I mentioned. And that included from smart weather information to chatbots to surveillance tools, contact tracking, and intuitive surveys, so on and so forth. It also included treatment recommender systems, and various other tools that are required for grassroots level work. Now, 3 years ago, when we demonstrated the impact at the grassroots, we were challenged to place such tools nationally. So in Indonesia, we took another leap forward. We entered the space of digital transformation. We built the world's first digital twin for disease early warning that you see at the top. It's a real-time interactive simulation of how outbreaks evolve in changing climate conditions. We designed national malaria dashboards, top right, and we launched a multi-disease decision intelligence platform to guide epidemic response across program levels that you see right here, bottom right, sorry. Now, what you saw was next generation epidemic intelligence, not in theory, in practice. And this is exactly what it looks like to build that. And finally, on May 5th this year, we ensured that this technology is owned by the country. That level of localization is critical for sustainability. So I want to emphasize the fact here that if we want to localize a particular technology, we need to be mindful about its sustainability and the coordination and resources that are required locally. Now, we talked about project-focused work at the community level, at national level, digital transformation. Now, when you try to embed these types of work in multilateral initiatives, one that we are doing currently with the Global Fund, and thanks to Global Fund, we have been able to take this vision to Bangladesh and Sierra Leone, and this will be in a few more countries later this year. So in these two countries, we are prototyping climate-informed early warning surveillance that merges local and global climate data with public health signals. So with these, we are not just building tools, we are building a new language of anticipation, one that speaks directly to the need of governments, programs, NGOs, and communities. This is how real-world solutions look like. But let's be clear, this work isn't easy. Countries need robust technical assistance, they face infrastructure gaps, limited digital readiness, and a scarcity of trained personnel. Data system remains fragmented. You heard that from the previous speakers. They are siloed. Insights often get lost between dashboards and decisions. And too often, innovation outpaces the adaptation. So we have incredible tools, but if they're sitting on shelves because systems aren't ready to use them, that's useless. This is the gap that we focus on, bridging at IMAX through implementation support services, with strategy, with systems thinking, and with leadership. And I will talk about it a bit next. So what do we see producing success, or from data to decision? The approach is pretty simple. First, we identify climate-sensitive diseases and climate indices that matter most. Then we build forecasting models tailored to national context, models that don't just predict outbreaks, but inform real-world responses. Strengthen decision-making capacities at both national and subnational level, and help governments write the SOPs, policies, and budgets that turn pilots into sustainable, localized solutions. So this is the blueprint from data to decision, and from decision to impact. So finally, the road ahead. What's next? How to scale? So first, we need to build full systems, not just tools. Systems that fit within national infrastructure, align with existing workflows, and adapt to local realities. Second, we turn forecasts into action. That means clear decision points, real-time data flows, governance protocols, and sustainable funding mechanisms. And finally, we need to institutionalize the whole ecosystem, embed it in policy, back with budget, make it part of how public health is practiced, not just piloted. Because that's how we go from success stories to systemic success. So finally, let me leave you with this. In the face of crisis, information is power. But in the face of uncertainty, intelligence is leadership. And in today's world, where climate meets contagion, we need both. So at IMAX, we are not just here to build data systems. We are here to make sure that right people at every level have the right intelligence at the right time to protect lives. So let's continue building the future of epidemic intelligence together. I know that there are several technical folks might be having technical questions related to the data workflows and systems. So for them, just to have a quick look, this is what, at a very simplistic level, climate data configuration looks like in a digital twin. I'll share this with Kaspar if you have follow-up questions. And this is how the methodological workflow looks like in a particular country for a particular system. This is specifically for our multi-disease decision intelligence system for Indonesia. So with that, thank you so much. And Kaspar, over to you.
Thank you so much, Kaushik. Questions from the audience? I have, again, one question. So you showed basically that the dashboard is at the end of your workflow, right? And going beyond the dashboard afterwards, are you in your technical solutions and digital solutions, are you somehow also build in how the technology is used afterwards as a feedback in the design process? So are you monitoring how people are using the digital tools afterwards?
Yes, we are monitoring some of the impacts. So I can show you how we do the monitoring, not just monitoring from the purpose of utilization of these tools, but what kind of impact looks like. So allow me to share one moment, please. So this is what the impact looked like when we did monitoring of application of the fever and malaria prediction tool at the community level. In a time period of 3 years, we achieved 81% relative reduction of malaria, 94% focal outbreak-free months, and 0% stock out days, 100% treatment within 24 hours. This is a district that you are seeing at the back end. That's the Malkangiri district. And in this district, the impact is pretty clear. 38% increase in fever surveillance while using those tools. 51% reduction in malaria cases during the period has already been published by Government of India. 64% reduction in transmission. And in 2023, as neighboring districts recorded 90 to 100% increase in malaria during outbreak, Malkangiri sustained more than 20% year-on-year reduction just using those tools, even after the completion of the project. So that's how the monitoring looks like. Over.
Thank you, Kaushik. So we would move to the next speaker. Pamela, are you there?
Yes.
Very good. Okay. Can you try to share your presentation? So I'm apologizing when mispronouncing your name now. So our next speaker is Pamela Chakun Uskamaita from Duke University in the USA.
Yeah. Okay. Hello, everyone. Today I'm going to present interactive visualization and prediction platform and malaria surveillance in the Amazon country. This is based on the project Improving Response to Malaria Outbreaks in Amazon Basins, a consortium of collaboration of the institution, as you see here. So to consider information about malaria, malaria is a major public health in the Amazon Basin. So that's why we choose to develop an interactive tool in a specific study area as part of these 3 countries, as you saw here. The disease spread quickly because there is climate change and deforestation. That's why we are considering use environmental data. And effective surveillance and predictive tools are crucial for managing outbreaks and enhancing health outcomes. So what is the malaria surveillance platform? As I mentioned, it's a tool to improve decisions, and our intended audience is the Ministry of Health officials and also regional directions to use. Okay, so this is a sign of the how we order this, the designing of this dashboard. So the first step to begin was the integration of different data resources. And then we start the dashboard design, right? So why we start with this dashboard design? Because as in these countries, there is many challenges. One of them is to access to the data. So it was relevant for us. Some of the countries have public data, others not, but also this changed through the time for many political decisions, another challenge that we have. So having a dashboard as prototype, it was interesting to show to the Ministry of Health, like we can mention that we could create this if we collaborate together and generate some agreements to have the formalized to get the data monthly, which is the main purpose is to update to this frequency data. And later to have some prototype, we apply some design focusing user experience and user interface. We developed different methods in each of these phases. I'm going to explain this later, but this is the main framework that we use. Like the plan was evaluate how was our content information, different features, and how was the presentation of this dashboard. As you saw in these rows, this process is always iterative. It's always changing through the time. Even the integration, sometimes we are trying to improve and adding more information. So this is just to remind. Okay, so now I'm going to show you the data integration. This is a graph that we can see more easy the flow. Like here we have the data sources, different data sources. One of them was from the land data simulation system from NASA. We have the hydrometeorological data, which is relevant because this information show us of giving more information how could change the distribution of the mosquito anopheles. Another information was the malaria surveillance and malaria interventions, the land use and land cover data of map biomes that contain the information from the Amazon area, the world population data, and socioeconomic. So after having of these data resources, we develop an ETL process to extract, transform, and load the information in a cloud data storage. To the idea of later develop some application focusing forecasting process and data visualization. So in this process of dashboard design, one of the first methods that we used was the expert interviews. So the idea is to apply design thinking's methodologies. Later to pass for this phase of ideation, we develop different prototypes. As you saw here, with 3 different experts. We have some small prototype in our Shiny, RGs, Tableau, just to create many examples to show in these expert interviews. So the main questions that we wanted to ask was to know what was the type of malaria chart that they mostly use, what data visualization they prefer, what they are using for different diseases surveillance, how sustainable are their current visualization tools, or what challenges or barriers they have to in this platform. So the teams of the Ministry of Health in Peru and Ecuador, mostly of their answers focus in our Shiny. And why we decided to create and focus more efforts in our Shiny, because our Shiny, it was notable for their affordability, and also it has a wide adoption in certain countries as Peru. Okay, so now that we know that we are going to develop an our Shiny dashboard, we divided this dashboard in 3 main sections: the explore spatial trends, analyze temporal patterns, and visualize forecasted malaria cases. So now I'm going to explain methods in this user experience and user interface design. Okay, so now that we have our dashboard, and the first method that we applied was to heuristic evaluation, which is a usability inspection methods where a small set of evaluators, in this case, that part of the team evaluate these heuristics to identify usability problems. We evaluate 10 Nielsen's usability heuristics. And this was really helpful to enhance the user experience. So I'm going to show you now just examples of two heuristics evaluation that we did. So this is an example of one positive heuristic evaluation. So we evaluate this heuristic number 6 in the section of floor spatial trends. And as you saw in this picture, it was really helpful. That's why it's positive. If they, for example, digitize a text of the name of the unit, it appears a corresponding option on this list. So that's reduced the time that they could spend if they make any errors when they type in the text. So after we identify these heuristics, we always have the same section of information, like what is the description of these heuristics, why the justification, why we choose to evaluate these heuristics, and what was their importance to. So now this is an example of a negative aspect. So in these heuristics, aesthetics, and minimalistic designs, as you saw in this picture, we also consider to see what happens if the user wants to see the dashboard in their mobile phone, which is mostly common to use, right? So we see how these two features overlap with a map. So this could generate problems to the user to not could see the whole information of this country. So we collect the same information, describe of the negative aspect, and with the negative aspect, we classify in the how important it is to make a change, like is high, it could be low, to improve our dashboard. So after we make the improvements, after the heuristics evaluation, we start doing these methods, applying some surveys. So now we collect information from 19 participants from the Ecuadorian Amazon regional government to collect information of the socio-demographic details, dashboard familiarity, malaria information, sharing preference, and design features for a data visualization platform. So as you saw in these pictures, the way that we share the graph or an idea, it was having them in just in one group. Mostly of them has their laptop, and then one of them, this person was in charge of develop the shiny dashboard. So he knows really well how to explain in case they have questions or they have any problems. So after collecting information, as I put here, we ask one question, like select all options they found they are useful and briefly explain why. And a part of it, we also ask what other information they found that it should be useful to see. So we divided this activity in 3 main parts. It's the main 3 sections, right? So we have the explore spatial trends, and I'm going to explain more details about one. And for example, in one section, we put numbers on the future. For example, we put number 1 for select country, slider time control, how to see the spatial visualization of malaria cases, but different year, selection type of malaria here, search some units, and visualization climate information. So we put in numbers, and they have to mark what feature they think that are useful or not. We did the same for the 2 and the 3rd section. And as you saw in this picture, the figures, in the 1st section, mostly of them think that mostly all of them are really useful, but in the 2nd and in the 3rd, they have just few of them feel that this slider time control, as you see here, are not so useful. And we have the same information in the 3rd section. So we try to precise why we have this situation, maybe because it's not easy to understand what they need to do with this feature, or maybe they need more information of this. Okay, then the next method that we applied was usability testing. So it was really important since the beginning to have our evaluation goals with this testing. The first was assess the time user takes to choose any variables and visualize data, access if users can interact with charts, interface, and compare variables clearly. The third was identifies usability issues when they analyze information across the visualizations. And the last was to understand if they could create or understand the forecasting data. Okay, so to develop the usability testing, the main goal of this was to create, it was a pilot, but the main goal was to create a methodology that we could apply later for the end users of each country. So in this pilot, we assessed by 4 health informatics students, and we apply this technique of think aloud. Think aloud is a technique that we record a screen recording. So even when they are thinking, whatever thing that they are thinking, which option to choose in the dashboard or what they are going to do next, they always speak about that. So we record all this information to understand how they think during the process, to knowing more the future of how to resolve the task. We collect qualitative and quantitative information to understand usability, efficiency, and pain points. So in the materials, a part of the informed consent, we use a terminology list to give them some small knowledge to understand more the tags, like what is malaria, what is these names, Vivax, falciparum, and what is the name of the units, in this case is parish. And the main part of the material was to give them this tags definition. So this was the 4 tags that we created for them: find a data point, compare variables, analyze the data, and predict cases. So I'm going to dip in one of them as an example. So we give them some context first, so about what will be the tags, and then we highlight, like, for example, these tags. These cover both the number of falciparum cases and the average soil moisture recorded for the parish of Napo in 2022. As you saw, these tags are like usual activities that one person that works for Ministry of Health should want to know, right? So now that they read the tags, they should develop or resolve the tags alone. So we didn't give any information on any suggestion. We just see and observe what they think, what options they select, what errors they do, or if they have any difficulties when they were developing the tags. So we collect some information in this process, like performance metrics and self-report metrics. So as part of the results of the performance metrics, we have this efficiency, which is the division of the task completion rates and the task time. So as we saw here, it was more or less efficiency for them, the task 2 and the task 3. This could be something related to the tags. Maybe it's not easy to understand, but as we saw after see the screening recording, in this task 2, the dashboard have some errors, or they has less information that was difficult for the users to identify that they should do click in any part to resolve these tags. And as part of the results of this after scenario questionnaire, which is a valid survey using for usability testing, it's really brief, as you saw. It's just 3 questions in a scale Likert. So we asked them about their satisfaction, about how easy was to develop the task, if it was appropriate amount of time, and also the support information that the dashboard have itself. So something that we also see, it was correlated to the first graph with the performance metrics about the task 1 and task 4. But as you saw here, the task 2 has the user think that it's more easy, but when we saw amount of time and support information, it's more difficult, the task 3, right? So we could notice, we could compare what happened when we measure these metrics, and also we have more information about the satisfaction the user feels. So as a conclusion, we see that to create a public health informatics dashboard, as you saw, it was really, it was a collaborative approach. It was really necessary, involve agile design, because everything is iterative, everything is changing through the time, as I mentioned. Implies have a multidisciplinary team, and some key aspects that I can highlight, it's include interactive design, participative work, attention to detail. As you saw, we try to highlight any detail that could generate some confusion for the user. And something that I also want to highlight, it's the co-creation with a stakeholder. It's since the beginning. As you saw, it was since design which of the software we are going to use, because one of the main goals was to have something sustainable to the time, to create a good tool that they could use. Thank you.
Thank you so much, Pamela. Questions from the audience or comments?
I have a quick question.
Yes, maybe you have to. It's from the room here. Just a second.
It's a very quick question, but thank you first of all for the question, for the presentation. I mean, the question is, where was the dashboard hosted, and is it still being used, or was it just for the research purpose of understanding how to build a dashboard that this exercise was done? Thank you.
Yeah, thank you. It's a good question. Everything it's still in process to developing. So for now, the dashboard it's hosted in the University of Quito from Ecuador. But the next step it will be still improving, working more with different stakeholders. Now we are working to create an agreement, formal agreement with Peru, and also we want to have the information from Brazil. And later it's to transfer what we created to their team of Ministry of Health.
Thank you. Makes sense. Thank you.
Further questions? I have a short one maybe. So I like very much this integration of the user and stakeholder perspective feedback as well. How strong would you expect a cultural difference effect to be in such as, if you want to do something like that in a different region of the world, would you expect totally different user feedback, or so how much of this user perspective is actually cultural driven, or is it just generalizability over cultures?
We noticed some of the difference just in the beginning of the interview, because in each country there are in different phases. Like for example, in Peru, they have their own dashboard in our Shiny, but they are interested in to add the forecasting part of the information. But for example, in Ecuador, it's the opposite. They don't have any dashboard to present the information. So we are considered that in the process to implement may will be some changes or little adaptation, because the needs are different for each country. But a part of that, we could also consider like having our own like integration information for each country. So it's like to cover both sides, the needs for the Ministry of Health, but also having information that could be sharing depending of the access that we have. It's because some data, as I mentioned, it's public, but other not. So depending of that, we could create something for Ministry of Health, but also another thing for research purposes.
Thank you very much. If there are no more questions, we arrived a little bit earlier at the lunch break because the fourth talk, as I said at the beginning, is cancelled in this session. So we are now in the lunch break already, and we would start again at 1 Swiss time. So that is 1 hour and 5 minutes away from now, for the third session in the afternoon. So see you in a little bit more than 1 hour. Okay, welcome back after the lunch break, and welcome to the third session. So this session is entirely under the topic of transcribing, new ways of transcribing historical data. And our first speakers are from the University of Bern, Tobias Hodl and Jan Blarer. So thank you very much for joining the workshop, and the floor will be yours.
Thank you so much, Kaspar, for the introduction and for the invitation. Great to be here. Usually not our crowd. Our background is more from the digital humanities, but since transcribing and all documents are involved, I think this is where we can contribute something. I'm reporting on a project that is currently being carried out together with Katharina Mattes from the University of Zurich. Jan is doing the heavy lifting and will take over in the second part, and I will start with a brief overview about the topic and what we try to do, and then wrap the whole thing up with our outlook. And with that, we can go to our second slide. The idea or the question basically is, how do we get from handwritten data in very strict and regulated form, here a case from Zurich, to something like a CSV, something that we can deal with and that we can analyze using our usual data applications. We will do that in 2 steps. First, we will start with text recognition, which is in this case really the easy part, I would say. And then the second step is really where it's getting interesting. So how can we deal with the different layout, visual informations, and how can we convert them into usable data? And with that, to the next slide, where we will briefly look at the data. Even on the next slide, we will have it zoomed in. This is a registry from Zurich, a deaf registry. It's from the city archives in Zurich. It's currently being scanned by the project team. And Jan, if you go to the next slide, we see the bit on the larger screen. As you can see on the top left, there's a numbering, handwritten, and there are some pre-printed parts. It's quite mixed, and if you're familiar with Latin script, you will see this is not how we used to write at the moment here in Switzerland, but this is an ancient form. It's a so-called current form, which still can be quite easily being recognized. And with that, to the next slide. We are working currently on 12 volumes. It's spanning around about 30 years, starting 19th century until early 20th century. The time frame has deliberately been chosen in order to adhere to GDPR, so that we can basically play around with the data and also send it to commercial entities without any data infringement. Each of the volume is about 200 to 400 pages, so we're really dealing with some 10,000 of pages that we want to process. And with that, we're getting to the next slide and to text recognition. Many of you will know that the current text recognition approaches are more than what we used to have with OCR, with optical character recognition. Most of the engines are nowadays using so-called neural networks. There are different frameworks around and also graphical user interfaces that you can using. We are mostly using Pylaya. The alternative would be Kraken. Both are open source available. The graphical user interfaces are eScriptorium and Transcribus that you can try out. They both have their advantages and disadvantages. At the moment, we are mostly working with Transcribus, since this is an instance that you can directly use and you basically pay for the use. Yes, next step. Next slide. For this text recognition, we are relying on, as already mentioned, on Transcribus, and they are providing what they call the text titan. This is a huge model trained on a variety of different scripts from the late 12th century up to the 20th century, but it's quite biased towards later times, and it's and this is why we've chosen to use the text titan for the moment. It's using a lot of German text for the training, so the recognition even of this now not used anymore current script is quite reliable. On the next slide, I just put as an example an alternative, just to showcase that you don't need to only rely on systems that are within graphical user interfaces. This is a very similar model that we published. No, good. Good. This is just an alternative that I will come back to at the end when it's about the next step in the process. And with that, I hand over to the more interesting part that will be presented by Jan.
So, hello from my side. I will rush a bit through this. First, we tried the Transcribus model with table recognition. That failed rather spectacularly because, as you can see, it's not really a table. In the second try, we tried to do it with a fields model. Our original plan was to, for every segment of interest, we will create its own field with a distinct tag. Those field models were trained with around 203 pages, and whereas each page has 2 cases. And the recognition of the fields in of itself worked surprisingly well, but each new form requires a new model. As you can see here, the layout is a bit different, and that means that there are some changes which may throw off the existing model completely. The layout of the deaf registers changes around every 10 to 20 years, so we have the problem that we would have to create a lot of models for various years. Another big problem is that the layout recognition of the text often doesn't match up with the layout recognition of the fields. As you can see here, can you see my mouse? The highlighted areas, actually we just want text in this field, which is TODES. But for some reason, transcribers gave us the whole line, which is not what we want, because ultimately fixing those issues would be a whole project of its own, because every extracted text would need to be analyzed and groomed appropriately. So our solution was to just simplify the layout extraction. We just created 4 new model fields, 1 ID field and 1 content field. The ID field contains the name and sort of entry registry for the deceased person, and the content field contains all the dates we are interested in, such as reason of death, place of birth, etc. Now, we do have some more problems with that. As you can see here, den 11. October should be the first entry in the list, but for some reason, transcribers made it second one. That's quite a big problem, because if, for example, numbers get switched up in the dates, they're completely unusable for us. And so we need to come up with a way to fix that. Another problem is that the content is currently unfiltered, so we just have a huge batch of text, which we don't really want because it's not, well, really usable. And then there's a minor problem, that is that the transcription of transcribers makes still some errors. So how do we try to fix those things? To get a sort of order in the lines, we have created for each year 1 separate text that is already clean and ordered, and we uploaded it to a large language model, and then we use that ordered text with the large language model to filter out the correct order of the model text and then apply it. And since every, oops, sorry. And then we continue with the filter for essentials. We use start-stop words. Basically, every year has some words that never change, like den, mittags, or beruf. And we use those words sort of as anchor points. That means everything in between those anchor points gets extracted. And that's also the main reason why we need to have an order applied to the text. Because with a random ordered anchor points might be all over the place, and so there's no inherent logic, and the extraction code we use would simply just not work. Eventually, we get this. This is a CSV. You can see over here the different tags, Todeszeit, Todesort, Ursache, and then this very huge tag right here, which we still need to filter a bit more. And as you can see here, it also works rather well with Excel. Now, the remaining problems are that transcribers seemingly has quite a big problem with recognizing numbers, and no large language model can fix that currently. There's also the problem that infrequent words, words like names for persons, places, institutions, or the names of illnesses are not recognized by transcribers or the LLM, and so we can't really correct those words. And the other remaining problem is that we still have too many filler words, which we need to probably add just more filters So we only get those specific entities we want. And with that, I give back to Tobias.
Yes, thanks, Jan. So in what direction do we want to go? Maybe first a very brief comment on the quality. The way it seemed now, it was like it's errors all over the place. This is not the case. We see character error rates in the vicinity of about 3%. So there are some errors in there, but probably 2 to 3 characters wrong per page. So it's still manageable, but of course, if we want to have perfect data, then this still needs to be cleaned. Now, what we want to do next is a second iteration. So currently, Katarina and her team is checking on the data and giving us a feedback on how usable this is, since it's her project and it's she that will do the data analysis, and then we will bit by bit replace the parts that are basically not open source at the moment with open source parts. So Transcribus, for example, we will replace with this transformer OCR model that I've shown you earlier. And the same goes for the whole text regions, lines recognition. There are tools available for that. We will try to do that using Kraken. And instead of the OpenAI API that we're currently leveraging when sending all of the data to ChatGPT, we will replace that with a self-hosted LLM, and at the same time evaluate how much we gain, what we lose, in order to also prepare a small paper on that. All of the code will be published on GitHub on our DH Bern institution, and the publication of the data will be up to the USETA team, and also this in conjunction with the city archives. That's already all from our side. Thanks a lot.
Thank you so much, Jan and Tobias. Questions from the audience? Maybe you can check quickly the chat, Tobias.
Yeah, I can say something about that. So
yes.
Pylaya, the Transformer OCR is using a language model which is BERT-based. So there is a lot more of super corrections, hypercorrections within the output. But we're looking into both Kraken and Transformer OCR, because for Transformer OCR we already have a large model. So yeah, it balances each other out a bit, depending always on what you want. And if you don't fear that the language model is too influential, then it's not an issue going with Transformer OCR. Yeah.
Other questions? If not, we can move in time, perfect time, to the next speaker. Thanks so much, Tobias and Jan, and also very much appreciated that you make everything open access afterwards. So that's really well appreciated. Okay, so next in line would be Mats Perner. Are you there, Mats?
Yeah.
So next in line is, next speaker is Mats Perner from Roskilde University in Denmark, who will speak about Copenhagen, data from Copenhagen. Thanks so much.
Yeah, thanks. And thanks for inviting me and hosting this seminar. So I am from the Pandemic Center at the Roskilde University in Copenhagen. I'm a historian, and I'm part of the group at the center that is interested in working with epidemics and pandemics of the past. And we have had for years ongoing efforts to digitize some of the many sources that exist in Denmark on this topic. And the title is a bit misleading, actually, because I plan to talk about a single source today. So what we in Danish would call the ulister. So these are weekly lists on mobility in Copenhagen for a very long period of time. So I'll present that source. I'll talk a bit about the registration, the structure of the data. I will talk about how we are currently and how we plan to transcribe them. So it's a project in a very, very early phase. And then I will present a small use case of what you can do with kind of data. So mostly in historical demography, me and my colleagues have been working on mortality, right? Because it's a source that is often available. What we often want as well is sources on mobility. But that was much harder to collect in the 19th century, and so those sources are much more rare. But we have this source in Copenhagen. It's a long run source with weekly publication starting in 1876. So it was printed and published every single week, containing a number of tables, and one of them is a table containing infectious diseases in the city in the past week. And because these publications were printed and distributed, they exist in many different archives, and so they have survived and are almost entirely complete and quite easily available, at least in a PDF form. So from 1876 until the mid-19th century, 20th century, sorry, we have around 3,000 to 4,000 weeks of data. And that means we have about 3,000 to 4,000 tables that we need to transcribe, right? Which is quite a lot. So it's a gold mine, but it is incredibly time consuming to do this manually, how we would usually go about this task. There are also some other challenges. So the tables change a bit, and so do the diseases reported. So I'll get back to that. And then there's this question of how well was the mobility of the population actually reported? Because with mortality and deaths, it's quite simple. You can only die once, and usually that death is recorded. But with mobility, you can be sick many times during the year, right? You could often be sick at home without anyone ever knowing about it. So I wanted to talk just briefly about the history of the collection of mobility data in Denmark, because the thing with all of these 19th century sources is that they're always part of some process of the health authorities sort of increasing their control and the accuracy of their statistics. And the same goes with these weekly lists. When they arrived in 1876, it had been quite a long time coming. So from the early 19th century, all physicians in Denmark had to report to the health authorities about the sort of health conditions where they were working, but this was in a qualitative format. From 1849, they were asked to, whenever there was some kind of epidemic outbreak, to assemble a table and send that in as well. But there were no kind of instructions about what the definitions of an epidemic outbreak were. So I suspect that data wasn't very workable. From 1876, they assigned these printed tables to all the physicians with a set of predefined diseases, and they had to report yearly the monthly cases, regardless of whether these diseases were epidemic or not. And then from 1876, they instructed specifically the physicians in Copenhagen to every single week report the number of cases from a similar set of predefined diseases. And they were specifically instructed to report the cases no matter how severe they were. So these data only exist for Copenhagen throughout this period, and for the rest of the country it was still monthly from 1876 onwards. So the question I'm digging into now, and I'm not completely finished yet, is I'm trying to estimate how well they were doing at getting all the physicians to report, because the physicians had to do it, but the chief medical officer of the city was kind of looking through these reports and had to write an overall report to the city council. He sort of reported yearly that only around half of the doctors in the city were consistently reporting these weekly cases to the city. And so part of that is probably that some physicians were out of town, or they were not really seeing any or that many patients. But there's also a good number of physicians who never really bothered to send in these reports. And so in 1889, they made it compulsory, and it was punishable not to report. And the morbidity that year increased by around 30%. So it might be that the physicians got better at reporting, but it also coincides with the Russian flu pandemic, right? So it's still not clear whether this was an increase in reporting or an actual increase in mobility. So the list looked like this, the tables. This is the first ones they made from the beginning. So I'll see if I can mark it here. So you had a bunch of sort of classic infectious diseases, right? Smallpox, measles, and so on. You had different age groups. And then we know exactly how many doctors reported data to the city that week. In 1881, they expanded it, so they included all the neighborhoods of the city. So we get a spatial component to this morbidity data. And then from 1887, they also included how many were admitted to hospital for each disease, which is quite useful for us because we are in a different project working on hospital protocols. So we can get some kind of measure of, if we're just looking at the hospital data, how many of the actual cases that were in the city are we seeing in the hospital, right? And this table remained somewhat consistent throughout the rest of the period. So here's one from 1918. So it looks quite similar, as you can see. What does change is which diseases were included and what the order was. That's a different issue. Okay. So currently, I've had a student assistant work on transcribing these manually, and she's transcribed a bit over 1,000 weeks of data from 1879 to 1898. But she's only done diphtheria, group, as we call it in Danish, and the flu. And based on this kind of test, I think it would take around a year's work for her to do just these 3 diseases if we want the full period, right? So this is not really, it's not really feasible to do this manually, and not possible within our budget because we want the full range of diseases in the data. So what we are starting to do now is try to figure out how we can automate this process. And this is the current plan, and our feedback is very welcome at this point. So I've given here an example of what one of these publications look like. So there are 2 printed pages, and the table that we are interested in is the one marked in red here, right? The other tables contain all other kinds of data on mortality and temperature and the winds and stuff that was interesting to 19th century physicians. So the first step is just to identify the table that we're interested in across these 3,000 to 4,000 publications, right? And we plan to use a fine-tuned open source table addition model. It seems there are quite a lot of options now to do that. We are hopeful that we can train a model to identify the correct table, extract that, and then normalize it, and then segmentate the table and recognize the numerical characters in each cell. So we're planning on only OCR reading the numerical characters and not kind of the columns and row labels, which might be a issue later on, since the order of the diseases can change over time. And finally, we can hopefully validate it in some way, because the last row of these tables always contains the sum of the column, right? So if we have the last row, we can check if the transcription is accurate across the table. Okay. Yeah, so these are the possible challenges I can think of. Currently, as I mentioned, we're at a very early part of the process, but we have both the table layouts that can change, as I showed you. We have the diseases that can be included for periods and then removed again. The flu, for instance, was included until 1887, and then they removed the flu because there were no cases. And during 1889, they realized they had to re-include it. So it went back into the table and so on. And I suspect this will be an issue, but I don't have the full overview of exactly how much it. Okay, I have a little time, so I just want to show what kind of work you can do when you have this data in high resolution. Diphtheria in Copenhagen was really widespread from the middle of the 1880s. And this was a point in time where child mortality was beginning to decline, and then suddenly the decline stopped due to a very long-lasting diphtheria outbreak. You can see it lasted around 10 years, where it was basically endemic. What we also know about diphtheria is that around the tail of this outbreak, multiple serums for treating the disease were developed around in Europe. And in Denmark, we have possibly the first randomized clinical trial to assess the effect of the serum, which happened in 1897. So as you can see, the randomized trial came only after the disease was sort of over. But we can use these data to calculate case fatality ratios to see, to kind of assess the effectiveness of this treatment, right? Another thing we can do with the data is look at how spatially distributed the outbreak was. So when I saw this sort of long-lasting outbreak, I immediately thought it must consist of a number of smaller localized outbreaks, which at the aggregate look like sort of one large epidemic. So we can look at that in the data, right? Because we have the neighborhoods. But the immediate impression is that that's not the case. So in most of the neighbors of Copenhagen, you do see this diphtheria epidemic as sort of one long-lasting outbreak as well. So it might not be the case that it's just a series of small localized outbreaks. I'll skip the last slide here because I'm running out of time. Thank you.
Thank you so much, Mats. Questions? Yes, Guillaume, please.
Yes. Hello. Thank you very much for this fascinating presentation. That's very interesting. I just want, so I'm a historian, and I just have two questions. One is more methodological. Maybe it's not applied for diphtheria, but you are like on the time where like some disease became infectious, so you have a lot of change also in the like theorization of diseases, of the way some disease, for instance, I worked on syphilis, and you had hereditary syphilis would disappear after. So how do you manage with that? And in more larger like perspective, I was wondering if you are like working, you and some of your colleagues also, to connect your results also with like the medical discourse, what like administrative, political, and medical officer of Copenhagen says at this time. Thanks a lot again.
Thank you. It's the first question. So the thing about diphtheria, for instance, that this outbreak that we are observing happens at the period where bacteriology becomes really useful for physicians to actually detect if the infection is present or not. That's a much larger issue in the sort of looms in this data, and that we are relying on the physicians to be able to accurately identify what disease it is. And the contemporary physicians are very aware that many of these respiratory infections, like diphtheria, they can appear similar to each other in the early phases, it's like the first week or so when you're sick. And it's only once they get into the hospital where they can test them, and they found out that half of the people who are being observed for diphtheria are actually infected with scarlet fever instead, right? And they see this stuff during the clinical trials that we do, but in the weekly list, we have to rely on the physician who originally reported that probably in the early stage of the disease, but the symptoms are not as easily to identify. I'm not sure how we're going to get around that issue, but we'll have to find some kind of solution.
Thank you very much.
For the other question, can you repeat the second question?
The second one was just about if you have kind of also a pluridisciplinary approach with what says the medical officers, the political persons on Copenhagen.
Yeah.
Like, you know, it just for me, it's just like the methodological approach, how you connect, you know, kind of a social, cultural, political history with like this kind of study of data. I have no answer. I just agree.
Yeah, I mean, so I think we will eventually, because we are. I'm curious to see how this how these data that they're beginning to collect are enabling them to make connections that they weren't able to make before. And when you look into the mindsets of the politicians who are trying to regulate hygiene and such at this point in time, everyone is mostly concerned with cholera, and cholera is not an issue at this point in time in Copenhagen. Everyone's dying from diphtheria or scarlet fever or measles or something else, right? So I think that these combining these data with the sort of medical discourse will help us see exactly how these new kinds of data that were accessible to contemporary doctors were able to help them see where the problems were and how they could address it. So it's also definitely part of it eventually. Yeah. Thanks.
Okay, thank you so much. Mats, there's also a comment by Tobias in the chat, so you might look at that and maybe reply. So we move on to the next presentation. So Joanna, Adri, it's your turn. Can you try to share?
Yeah, sure. I'm trying to share my screen. Sorry.
Okay, so our next speakers are Joana Maria Pujadas Mora and Adri Molina from the Open University of Catalonia in Spain. Thanks so much for joining us.
Adria is from the center, from the Computer Vision Center.
Yeah.
And the one who is going to present is Adria. I will be around.
That's good. Thanks so much.
She will be my historian if I just fuck up
exactly.
with some facts. So bear with me with that. So good morning and hello, Kaspar, for the introduction. I will try to be brief and just give an overview of what are we working in the Computer Vision Center, the Demographic Studies Center, and the Open University of Catalonia on how we are trying to create a digital twin for the history of Catalonia. So first of all, and the most important thing, is that this is the Everest peak. This is the highest point in the surface of humanity. But I don't care about mountains. I care about historical documents. So I piled all the photographs from the historical Catalan archives, which are digitalized one after the other, and we have more data than the height of the Everest. If we take all the photos, regardless of their digitalization status, we end up with a transcription process which would take 15 centuries of continuous human annotation. And this is a problem because we are losing a lot of history and a lot of facts about our history and culture in that historical data. Fortunately, we are in the 21st century, so we have AI and we have PhD students which are working very hard to solve this problem automatically, right? However, if we have one random photographs, nowadays we can just rely on LLMs and ChatGPT. It's the state of the art in every, mostly every task in image analysis that you may imagine, and it will say something which is pretty much amazing that it can say with just given a single example, which is that this person was Jane Topan. She was a serial killer in the United States, which it's pretty amazing because this model was not trained for recognizing historical events and historical photographs. And this is because it's just an invention. This is wrong. This person is not a serial killer. This person was the first medical student in Spain. She revolutionized and is a symbol for the education of women in the university in Spain. And if we use these kind of methods, which they appear to be very confident and very good, we would be eroding the history of women in education in Spain just by not having enough care of that. And typically this is called a hallucination, but I am the opinion that only sentient creatures can hallucinate. This is something we have been calling for a long, long time as spurious correlation, which ultimately, and I don't have time to explain this example, which illustrates very good what deep learning problem is, that we cannot trace the reason for an error of an model, any kind of model. This is an example of detection model on which nor the environment nor the items that are around the bird will make the error be one or the other. It's just something that we cannot trace at all. And that's because deep learning doesn't care about facts at all. But if we can repeat the example with another historical photograph, we'll have the same problem. It will just completely make up the answer. But whenever we can find historical sources and written sources that contain relevant data, then the model starts behaving more properly because we have found textual examples defining what those visual examples are, right? So it seems like having a textual source, a multimodal source, which is called, it's quite useful for annotating history. However, it is not easy to construct such multimodal source connecting all the images with all the documents because, as we have been talking so far, transcribing documents is not easy. So this is a little bit what the project Xarxes is about. When we say that we want to build a digital twin for our history, we mean that we are aiming to take all the historical records that we can find. In that specific talk, I will focus on how did we transcribe, or we are transcribing local census, but I will talk about technologies that are a little bit more generic. To little by little end up connecting all the facts that are connecting people. For example, if they were living together, if they were married, if they were living in a home, but in a servitude status, all of these connections, we want to reproduce them in a digital environment in order to be able to construct this multimodal digital twin of the history. So the first thing that we have been exploring so far, it's quite obvious, it's recognizing directly the text. No? Handwritten text recognition is the task of transcribing text from raw documents. For this, we'll know what you need. You need document images, you need the literal text appearing on these images, and if you have the word level annotation, it's way better. However, it has several challenges. The first one is the writer variance. Not even humans are good on recognizing most of the human written text in modern situations. Most of you, or some of you, are teachers on different universities, and you have to recognize the text of your students, and this is hard. Just imagine how hard could it be from a student or a person from 2 centuries ago, right? Also, in modern handwritten text recognition, you have dictionaries, and you can rely a lot on words that are repeated through the document, certain structures of sentences which can be leveraged to enhance the predictions. In historical documents, it's not quite the case, because when you're playing with such a wide range of historical documents, in these examples, we have 5 centuries of marital records. We have the same quantity of demographic censuses. So you have a lot of variance on what words are appearing, and therefore you cannot rely on these textual shortcuts. And the inconsistent transcriptions, because images can have noise and these kind of problems. So handwritten text recognition is not always the way to go when you want to construct these kind of databases. That's why word spotting appears as a counterpart for word recognition, on which rather than trying to recognize the literal fragment of text, you try to find instances of document, visual instances, on which a word could appear. In that way, regardless of the correctness of the transcription, we can find the specific word with a certain flexibility. This is an example that, if I can share the slides at a point, I could, or you can contact me, you can explore, on which if you train good enough word spotting model, you will see how different fragments of text can be clustered regarding if they are similar or dissimilar. And this is something that, believe it or not, is a little bit more complicated or subtle when using literal transcriptions. So once we have the spotted text or the handwritten text recognized, we can push the boundary a little bit forward. And instead of just taking the literal text, we can start seeking for meaning, right? And the first thing that comes to my mind when I think of seeking for meaning in documents is named entity recognition. Named entity recognition is the task of not only annotating what the literal text is saying in the document, but rather which functional properties have different words with respect to text. This is useful because in that way we can populate the database not only with literal texts, which is not quite useful in digital environments, but rather in which functionality those texts are appearing. And we can clutter names, surnames, occupations of people, and have a more rich database. So at the end, if you need to do such a task, you need to provide the same thing as in handwritten text recognition, but also you need to provide word by word, which is the function that this word is having in the sentence. And this can have a lot of issues. First, because not all functions appear on the same balance. Some, for example, names could appear more in the form of proper names of people rather than locations and these kind of issues. So this imbalance can cause the method to fail. And also that this approach relies on named entities, which they don't have a meaning by themselves. They have a functional meaning. Therefore, because you cannot rely on this, what is called the distributional semantics hypothesis, you can have a lot of errors. And this is related to the latest challenge, which is the polysemics, on which a word, regardless of which is the word itself, it can have different functionalities depending on the context. But once we have this very narrow sense of functionality, we can establish functionalities across different elements of the documents. And this not only applies, and we have tried examples, not only on textual documents, but also on historical documents, such as music scores and a lot of examples, which is what is the functional relationship between two elements in the document. This can be in these very basic examples, a functional relationship of subtotal and total of a invoice, but it could be also in a local census. I don't have the example. Mother and son, or people living together, functional relationship, right? And in this way, we have been populating a database with documents from this region of Barcelona, the so-called by Joana de Pol database, which stands for Baix Llobregat, this region of Catalonia, on which we can find yet again different censuses and establish these functional relationships on the censuses. However, what we find is that there are people that can appear in different documents, and so far we have been connecting those people inside of the document itself by functionality. This is the mother of this person, this is the son of this person, whatever, but we are not connecting the people throughout the whole history, right? And precisely this is the task of record linkage, which is the last step for forming this structured database, right? So first, we want to transcribe the documents and detect the functionality of the words themselves. Then we want to link those words according to functionality again, but intra-document. And once we have these links declared, we have the task of record linkage, which is trying to link different instances of the same word throughout the history. Once we have all this process complete, we can dump all this data into the digital twin database, a structured database, or a graph database with this information. And we can log all this information for different aspects. Joanna has been using it, and correct me, for both epidemics and this study also of matrimonial information, heritage information, sorry. But we can find many other uses. So you can explore most of the database by free, just typing names and so on. This is completely public. Most of the data, however, is not public for legal reasons. But yeah, you can explore where the people was living, who the people was living with, what's the genealogy of the people, what photographs we can find of those people, which population data is attributed to each period of time, and so on and so on. So this is just a little bit of the data that we have been completing right now. This is not completely updated yet. This is closely to be updated. We have not done a minimum % of what the whole history of Catalonia is, and it's been a long time and a lot of work. So we have a lot of work to do. That's why we have relying a lot of digital science, citizen science projects on which people can volunteer themselves to annotate those documents and to help us with this process. And yeah, this is a little bit of all the scheme of the things that we have been doing for creating this digital twin. If you have any questions, I didn't measure the time. I think I went a little bit fast, but many thanks.
Thank you so much, Audrey, Joanna. Questions? If not, for the sake of time, because we are running behind a little bit, we move on to the last presentation. Thanks again very much, Audrey and Joanna. Very fascinating project and great effort. So the last presentation is actually a shared one between Christian Möller-Dahl and Rick Moritz, but I think Rick is still on the move in the train somewhere. So that's why Christian is presenting. I hope that was correct. So Christian is from the University of Towson, Denmark, and Rick is from the International Institute for Social History in the Netherlands.
Thank you very much, Kaspar. Yes, Rick is on the train, so we thought it might be safest if I present it. So let me see if I can share my screen here. Good, very good. All right, so yes, so I'm speaking on behalf of Rick and me, and it's basically sort of a summary what happened on this workshop in Guimarães in late May, a workshop that in many aspects looks very much like the one we have today. So with focus on transcription, and with, as you can see from the program, or maybe you cannot, there was preliminary or plenary sessions, and then, and this is what Rick and I'm going to talk about today, there were basically two workshops, sort of hands-on workshops, and that is basically what we would like to share with you, basically what we covered there. So that's the purpose. I'm not going to talk about the plenary sessions, but only on these workshops and basically how we talked about automatic transcription there. All right, so so the entire workshop was over 2 days, and on day one, the first hands-on workshop was on basically getting started with the automatic transcription. While the second day we became a little more sophisticated and looked into more advanced techniques. The purpose here was to give sort of a low-level hands-on introduction to automated transcriptions, of historical documents. And what was a key element here was also that the participants had submitted some of their own documents that they were working on, and we tried to the extent possible, basically, to incorporate that in our workshop. So that was the purpose. Okay, so day one, this introduction to automatic transcription. So basically, what we did there, the scope of that was starting by motivating why you should spend some time on this if you're interested. So giving examples on how digitizing records can enable, new possibilities for analysis, maybe new possibilities for testing new hypotheses or revisiting old hypotheses. And also, and that was also a very important point we made and we discussed, how this makes data usable and reusable for the many, and not only the few that can actually do the transcriptions. So this was a very, very important point. Then we discussed learning from the past. We gave an introduction to the most recent developments based on AI, covering many of the things we've also been talking about today. How can we use large language models? How can we use more specific and trained models? All of that was covered there. And we did not sort of hide the truth. And that is, yes, AI techniques are powerful, but we have to recognize also that they do require some level of technical expertise in order to be able to carry them out. And this is an important message. I mean, you really have to be careful if you're not familiar with Python or JavaScript or Java to venture into this alone. I mean, I think you need somebody that you can work with on this if you're completely new. Otherwise, it will be too huge an investment. We also discussed, finally, key principles for success, and provenance trails are super important. I mean, the importance of documentation. These transcription pipelines are typically very long. So documentation for what's happening each step is important. And also for what we strive at, of course, is replicability. So that was something we discussed in details. And then also what can help transcriptions in many situations is that if you use auxiliary data, for instance, if you are going to transcribe names, it's very good if you have a list of possible names that it can choose from. If you have, if you're transcribing death causes, what is the range of possible death? All that will increase the precision of your transcription. So we discussed that. And also we discussed the importance of metadata and the fact that you should always be able to trace back to the original sources. Now, then we went on to the more hands-on activities and demonstrations. We gave some historical documents, and we discussed how we should go about transcribing those. Basically, standardization is a very important thing, and encoding is another very important thing. So we discussed that based on some examples we gave. We also discussed that OCR, as we've also seen today, which OCR machines you should use very much depends on whether you have floating text, whether you have semi-structured data, or whether you have tabular data. So we discussed various ways to go about that. And everything sort of with an outset in also the documents that the participant had brought to this workshop. So we looked into those in different groups. All right, so the overall takeaway from day one, we emphasized that automatic transcription is powerful, but it's not a magic bottom. It relies on careful planning and understanding of our source material. Again, I think that's well illustrated with all the presentations today. And well, the hands-on sessions was basically to give the attendees, a real feel for what's actually going on here and what you have to consider before you basically start the automatic transcription. Okay, then we went to the next day, and the next day became somewhat more complicated and was a little bit more difficult to sort of, enforce the hands-on. But the scope of day two was, first of all, giving the attendees sort of an idea what is an end-to-end pipeline for transcribing, in this case, tabular documents, so there's a structure, and on a large scale, a very large scale, and also very dense tabular documents. When you do automated transcription, it basically turns out that you get new tools for doing linkage, record linkage, because now you get confidence scores basically on each character that you transcribe. And of course, you can use that for improving your record linkage. We didn't discuss part 2 too much, so I'll skip that also here. And then finally, because part 1 was basically at scale, meaning that here, you know, we basically assume that we have like millions of these tables. So for instance, US censuses, Swedish grade sheets, Swedish death records, something like that. Whereas in part 3, we introduce multimodal agentic AI framework. So basically we're using large language models in different capacities. In a capacity of OCR, but also in a capacity of basically validating whether the OCR is correct, and then reasoning if it's not correct, how should we change our prompt in order to come up with a better transcription. And this can be done on 500 documents, it can be done on 1,000, but it cannot be done on millions of documents. It's simply too expensive and too slow. So there was these different parts in day 2. Now the pipeline that we discussed is very, very straightforward. Basically, all the papers presented in Portugal follow that pipeline. So first a layout classification, then a table segmentation, and then transcription. And of course, the idea of table segmentation is that you mathematically comes up with a much simpler representation of the area on the image that you're interested in transcribing, therefore also increasing transcription rates very much. So, and actually it turns out that layout classification, I mean which of these, you know, documents in your huge pile of documents are actually interested in transcribing, that has become quite easy with the new visual large language models. But table segmentation is still pretty hard at a large scale because large language models are not able really to identify this table structure, something we've also seen today discussed. Once you have the segmentation, it's actually pretty easy to segment what's on that segmented table cell. That is not a big deal anymore, but table segmentation, large scale is difficult. So when I'm talking large scale, I'm talking, you know, documents that are dense in terms of a tabular structure like this. The one to the left is Swedish table grade sheets, and on the right is US census data. What we then discussed was how you do that, and basically it's based on AI techniques for semantic segmentation, identifying table lines using semantic segmentation, segformer in particular. And then once you have that and you have a template, you can basically match whatever source you have to the template using point registration. So basically you're matching all the segments belonging to lines on the source and the template, and then you can extract the data. So we have actually a demo where you can do that. It's in Gradio. So if you have a tabular document, you can basically put that in there, and then you can get your segmented table cells out. So that works pretty well. So we talked about that. And then we talked about this record linkage. We didn't talk too much about that, so I'll skip that. And then finally, which I think was quite important and quite well received at the workshop, was, you know, what do we do if we only have quite few documents and we want to use the existing large language models? So what we showed there was that you can actually, you know, put up a system like this, which is a multimodal agentic AI, where you basically have a document retriever, a large language model, let's say Gemini 2.5, and then you basically ask that to sort your documents. It can do that pretty fast and pretty good. And then you can actually also ask that to OCR it. If it has too much tabular structure, you need to go through a layout identifier and the table parser in order to help it. Then you can send your OCR to a reviewer. That can be an open AI, a different large language model, and it can sort of, you know, see if it agrees or not. Does it seem to be does there seem to be any strange OCR things in there? And if it accepts it, it moves on, and then you have an annotator who basically transcribes it. Again, many of the examples I've seen today, I think actually if you use Gemini 2.5 Pro, if you're allowed to use that, then I think it can basically transcribe a lot of the examples I've seen today. It's very, very good at transcribing handwritten text. And then it can also basically, output structured data. You can use what is called Pydantic. Pydantic you can restrict that such that the large language model only output in JSON format by using Pydantic. So and this particular multimodal agentic AI, we demonstrated how it works on some of the documents that was brought by the attendees. So again, and this is easy in the sense that you can do it if you have access to Google account or an OpenAI account. You can do this right off the batch, and it requires a little bit of Python scripting if you need to do it on 500 documents. But it's really not a lot, and it works surprisingly well. I think it works much better than Transcribus, and it's much less expensive. So that was basically it.
Thank you so much, Christian. Questions? Comments? I especially, value the initiative of knowledge transfer initiatives in a way, or the event. This is why I think it's so important that we have that workshop today, but also the workshop you organized, because I share your opinion that there are still these specialized teams, and if you are lucky enough, you have a funded project with where you can basically work together, right? And you have funding to really do it properly. So you have access to a specialized team, but and that works within a funded project very well. Right. But somehow, there is, to my opinion, always still a little bit of a gap to, to basically the end user afterwards, and initiatives to bridge that gap, like the ones you presented here, and also a little bit what we do today. So I think this is really important.
I totally agree, Kaspar, and I think also I think I think it is important to recognize that even though we have these easy accessible tools, it's easy just to run like 100 documents through an AI LLM. But the problem here is how do we evaluate the quality? And that is where I think the expertise of people who can actually script is super important, because that's not easy.
Absolutely, I fully agree. Yeah, any comment, question?
I have one. Yes. Bastian, you said we could try the table parser on Grade. You could post a link to it in the chat.
See, that is it's still the problem is that my university does not allow that I can post it. It's Gradio, meaning that basically I can post it on my server, but I can only do that for basically a very short time period. Although my university shuts it down. So it can only be hosted on a cloud, but that then costs money, and we haven't the funding for that. So it's that's the problem here. So I'm not allowed, because once you open up for that, of course, somebody can just enter our systems here at the university. So but we can talk about it. Of course, there are ways of sharing that, but not sort of an easy link.
Okay. Cool.
Unfortunately, but we're working on it. So but we require a little bit of funding before we can basically make it public.
There is a comment in the chat by Nuala Woodman.
Maybe if I can, Kaspar.
Yes, of course, Guillaume.
Thank you very much. Thank you very much. It's very interesting. I'm just so for me, I really don't know. I just know a little bit about that. But I'm very interesting about like the reflection you made, and also what is the place in this kind of work for the human, like, and also for the different kind of researcher in a pluridisciplinary team. And just on this last slide, you show like there is 2 times of review.
Yeah.
Just maybe if you can elaborate on that, and
yes.
Yeah, on this global reflection. And thanks again, and thanks Kaspar for this.
Yes. No, very good questions. I didn't think I have time to go too much into what I actually presented down there. It was just, but I think if you had time, Kaspar, I can explain this a little bit better. So the thing is, the reviewer here is so basically what happens is that you get one of the LLMs that we've talked about today that many have presented. I prefer using still the closed source models, and I think they're very, very good. So once they have OCR'd, so basically you ask it to OCR maybe a small part of the document, and once the OCR comes out, the reviewer looks at that, and the reviewer is a competing model. So in my case, I use O4 Mini, which is one of the new OpenAI models that are very good at visionary tasks. So I ask it, do you agree? And what it does is then that it OCRs it also, and then you can some kind of distance measure. You can see how far is it from. And typically, what I also do, if possible, is that I use Asia OCR, their new model for Asia, because what that does is it gives you confidence bands on each character. And if the confidence bands are pretty low, and what you do actually, you give the OCR and you give the confidence from Asia OCR to the reviewer, so that, and which is a smart LLM model, so it combines them, say, look, it seems that the confidence bands are too low, and I don't agree with the OCR. So you can then make it rewrite the prompt. This is why it has this reasoning capabilities, these new models. So based on the reasoning, you can ask it to rewrite the prompt. So you rewrite the prompt, and maybe you ask the document reviewer, which is Gemini 2.5, say that, look, you took too large a chunk of the document. Maybe focus on the upper right corner. And then you go through again. And then at some point, the reviewer says it's okay. And this prompt here is then saying, look, now I want the data that you extracted from this document. I want that parsed structurally. So I want a structured output again, which we saw. I think it was from Jan and Tobias, where they get this structured. They got it in CVS format. I prefer having it out in JSON format or Markdown format. I think that's easier to work with. And then you get a reviewer down here. So did I get it correctly as a JSON or not? And if it didn't get it correct as a JSON, you ask it again, please give me a JSON or something like that. So you rephrase the prompt. And this is how it goes until you get your structured data, a CSV or a JSON or a Markdown that you then store in your database.
Okay, looking at the time, I think we arrived at the wrap-up, the very short wrap-up. So thank you very much to all the speakers, but also to the audience, the participants for basically speaking up and contributing. So I think the aim of the day was to show and highlight a broad range of methods and topics and also time periods. And I think we achieved that very well, looking at all the contributions we had. And there was really something in every contribution presentation that most of us can certainly take away with them after the workshop. So I think I will now, with I'm looking at Tim Riswick in the room as the chair of the panel, but I think I have to write a summary of the panel, the summary of the workshop today for the IUSSP webpage. So I will do that. And I think my impression is that this field is really developing really fast, technically speaking, and I would look forward to see what such a workshop or meeting would look like in 2 or 3 or whatever years, to see where we got in the meantime technologies wise. So thanks again for participating, and I wish you a very nice day. See you soon. Thank you so much. Goodbye from Zurich.
Thanks. Bye.
Bye, everyone. See you soon.